Hello, everyone. Good day. Good morning to those in Washington, and good afternoon to those in the country offices. And it's good to see everyone. So this is the a session on as part of the Resilience and Disaster Risk Management Week, as part of our GP Learning Days. And to make sure you're in the right session, this is the one on raising the stakes on gender in disaster risk management. Um, and this is, I think, an interesting discussion, at least to me, because it's about how do we address the gender gaps, both in our analytic work and also in our operations, both the urban and DRM ones. And of course, gender is one of the three corporate priorities, right? In addition to co-benefits, participation, and then the gender aspects. And at least in the context of Africa, all the projects, the Africa region, all the projects we've been lately taking through the ROC process, we've been asked very specifically, not just about gender tagging, but also what the projects are doing about the gender dimensions. So we know that, disasters, when they happen, they affect the different populations differently, especially with women being more vulnerable, since they typically don't own the land in most of the countries we work in. They're also less likely to have a bank account, and then the assets are more vulnerable that they own than those of men. So this poses a challenge for us in terms of how do we tailor our interventions to help all of the populations. And oftentimes the numbers we see or the data we find are very aggregated, and they are not disaggregated by gender, for instance, when we do collect the data. So if you were able to disaggregate the data a bit more, we could then also have more opportunities for specifically tailoring and targeting our interventions, right, to the different groups. So with that in mind, I think we have 4 really exciting presentations here, starting with Alvina, who's an economist in the GFDRR unit. And she's the lead author of the Gender Dimensions of Disaster Risk and Resilience. And then Arjola will be the next one, who's a gender analyst working GPL Gender, and has worked in country profiles on Ethiopia and Senegal. And I was closely involved with those as the team was preparing it, so it was very exciting to see that work. And actually, the team in Ethiopia, when we had the ROC for the recent DRM project, they specifically referenced that report, which made the RVP very happy. And he was asking how other GPs could also implement parts of that report. So I think it's important to disseminate it more widely. We will then have a presentation by Marcela, who will be talking as a lead gender specialist for the Canada Caribbean Resilience Facility, and has led work in the Jamaica country, work on the Jamaica country profile. And then finally, we'll have Cindy Sue, who will be our discussant, who's a senior operation officer, also with the gender group. So with that, let me hand it over to Alvina to kick us off with the first presentation. And each one will have about 10 minutes to do the presentation, and then we'll have a Q&A afterwards. So over to you, Alvina.
Thank you so much, Peter, for that. Just want to confirm you can see the presentation, right?
Yes, we can see.
Yes, perfect. Okay, so thank you everyone for connecting. We're excited to host this session. So I'm going to give a brief presentation of the report, The Gender Dimensions of Disaster Risk and Resilience, which was published about a year ago. This report, some aspects of it has laid a foundation that the other work presented in the session has been built on. So we thought it was a good idea to bring it back and kind of refresh our memory and provide a summary of this report. So why is it important to talk about gender in DRM? So we know that there are differences in the ways that men and women and boys and girls are experiencing disasters. And an improved understanding of the drivers can allow us to adapt policy and interventions in ways that mitigates the risk of disasters affecting one group in society disproportionately. So it's not always women and girls who are worse off. So we need a nuanced approach when looking at this. And there is a lot of interest in this topic and not as much evidence. So as a consequence, we have seen a lot of policy and advocacy notes in circulation that intend to repeat myths and stereotypes without much backing. So with this report, we hope to provide the DRM community with a clear sense of what we know and what we don't know when it comes to gender and disasters. But it's more important also to keep in mind that this report is not meant to replace the need for local assessment. It's more of a help in guiding local assessments, as we will see in this report, in this presentation as well. So to understand the relationship between gender and disaster risk resilience, we developed this non-linear framework. The orange circle represents the disaster impacts. We look at disaster impacts broadly, from assets in income losses to health, education outcomes, employment and consumption, voice and agency, etc. The impacts that people experience is a result of a natural hazard that happens. Natural hazards covered in the report include floods, droughts, windstorms, earthquakes, etc. But we don't cover the epidemics or pandemics, since it's largely covered in the health literature. Natural hazards are gender neutral. This means that the wind of a cyclone won't be stronger just because there's a man or a woman in the way. And gender inequality is the purple circle here. And this is a product of gender roles and discrimination in a society. And gender inequality influences socioeconomic status, a level of agency, behaviors, etc., of men and women. In the area where gender inequality and disaster impacts overlap, we find factors that determine the size or the severity of disasters, but that are also influenced by gender dynamics. And these includes exposure, so who and what is at risk of being affected, level of vulnerability, which is the susceptibility to damage once affected, and the resilience, which as per our definition include preparedness and coping capacity. In this overlay space, where gender differentiated impacts happen, these impacts of disasters can exacerbate gender inequality and, by this logic, also worsen resilience. So this is why disaster risk management should operate in this overlay area. This means good DRM should consider ways in which gender dynamics influence disaster impacts in any given area before making decisions on policy or project design. So let's turn to some of the results of the report. I will highlight a few findings from each area in the framework. I will focus on exposure and vulnerability first, and then on resilience. And I will also cover or present the policy matrix that is in the report, and then also some next steps and what the progress have been on those steps since we published the report. So on exposure and vulnerability, I will only look at two aspects here. So we'll look at health and mortality. And a common question in the gender and disaster literature is whether more women or more men die in disaster. And included here is a non-scientific comparison of the literature and studies that have assessed this question. And they focus on very different hazards and use different data sources. And about half find that more women die, and about half find that more men die. But what we do see in the global comparison, the first one listed here, and also just by looking at some of the countries here, we do see that it tends to be that in developing countries, more women tend to die, and socioeconomic status of women is a major driver here. In countries where women's socioeconomic status is lower, more women tend to die in comparison to men. So we will discuss some of these socioeconomic status socioeconomic drivers throughout. So on economic outcomes, we see that where women and men depend on different sources of livelihood, they will also be affected differently from disasters. Often, women are engaged in sectors that are vulnerable to disaster impacts. For example, women in low-income countries tend to depend more on agriculture than men. We also find that due to exclusion from land and property ownership and lower access to bank accounts, women tend to hold a larger share of their assets in tangible form. This makes women's assets more exposed to disasters. For example, let's look at this composition of household assets in Bangladesh. Only 1% of land belong to women. And among women's assets, 50% is made up of jewelry. This is a common way of poor women to keep savings in South Asia. And it can be an effective saving method. But in a flood, these valuables can be easily lost, and this would undermine her already disadvantaged position in the household. The same study also looked at drought in Uganda and found that wives' assets are more negatively affected than that of men when a drought happened, despite that women only own about 10% of total household assets. So let's move on to resilience, and we cover here preparedness and coping capacity, but in aspect of time, we jump right into the coping capacity. So one key aspect of disaster recovery is to be able to access funds after a disaster. The use of savings is one of the most common coping mechanisms. As discussed previously, women's savings are less protected, and this is noticeable also looking at the kind of regional averages of bank account ownership across the region. Women are less likely to own bank accounts than all of them. So we also know that having access to emergency funds is a good predictor of the ability to recover. And here we also see that men are more likely to be able to obtain emergency funds. And also when we look at the source, we see that women tend to rely on more informal sources of emergency funds. In this case, we look at the, wherever the funds tend to come from family and friends, which could be a potentially less reliable source of funds than alternatives. So let's conclude this part with something that's well understood in the literature, but perhaps so much in practice, that men and women and boys and girls inside of the same household tend to be very differently affected from disasters. So understanding the drivers of gender differentiated impact is an opportunity for policy design. So in the report, we developed this policy matrix that links actions both to the different sections of the conceptual framework and also to the timing of when the intervention can be implemented and useful in terms of the disaster cycle. And I will refer to the report for more details on this. Oops. So here, in the report, we identified a few next steps. And now a year later, we can look back and see if we've seen any progress on this. And this is just my own kind of reflections. On moving beyond anecdotal evidence, I do see some progress on this, and I think it's primarily due to the second point here, that we've been able to leverage data sources and technologies that have enabled us to ask some questions that we haven't been done before. But I think that DRM still lags behind other sectors in terms of doing impact evaluations, which I think would really shine some light on some of the gender dimensions of the impacts of our project and of in the context that we operate. And finally, in terms of doing more local assessments and supporting country teams, which was a gap that we identified, we do see that we've made progress, and with that, I will hand over to my other teammates that have worked on specifically this with local assessments. So I will hand over to you, Ariola.
Thank you, Alvina. Can you hear me?
Yes.
Okay, thank you. So hello, everyone. My name is Ariola Limani, and as Peter mentioned, I'm a gender analyst working with urban resilience and land global practice. It's great to be here today to present the country profiles. And if we can move to the next slide, please. So I'm going to start this presentation by mentioning what were the motivations of this work that we did. Then I'm going to also introduce our approach that we took to carry out the country profiles, and then we'll move on to some findings of the country profiles and key recommendations. So what were the motivations? Over the last few years, we have seen a demand for country support to bring the concepts of disaster risk management and gender together. During conversations with operational teams, it was clear that there was a special need for country-level information, and more specifically on how to identify challenges that women face before and after a disaster happens. In the process of meeting this demand, we partnered with GFDRR, which at that time had just launched a report that Alvina just introduced. And the report included the framework that Alvina presented, and we decided to pilot this framework and develop 2 country profiles, one for Ethiopia and one for Senegal. Now, I'll briefly explain the approach that we took. So what we did is that we actually reached out to teams who had upcoming DRM projects and had expressed an interest in getting some guidance on how to do a gender gap analysis. And then once we established this report, we started having discussions, including with DRM teams. Each DRM team also assigned a focal point. We included in these conversations social development specialists and also country economists for each country, for Ethiopia and Senegal. And we saw that the inclusion of country economists was super important to be able to identify specific data that we were looking for. In the meantime, we also started identifying key DRM institutions in the country and starting having conversations with the representatives of these key institutions to kind of hear from them what were their challenges, were they looking into some specific data, or were they doing any data collection at the time. To guide our discussions with the teams and the client countries, we developed a list of key questions that we would refer to during our conversations. And we also developed a data matrix for what type of data do we need it. And all these questions and data matrices were focused on the framework that Alvina had developed. So on the categories of exposure and vulnerability, preparedness, and coping capacity. So these categories and the documents that we developed guided our efforts to identify these challenges that women face in a country context. Our 2 main takeaways from this exercise were that it is very important to reach out early on to the resources that are included in the GPO or in the region in terms of being able to conduct a gender gap analysis. And more specifically, when we are discussing for a specific project, having that brainstorming session start early on when you are in the design stage of your project, it helps to identify specific gaps that will fall under the PDO of your project. Another important takeaway was be able to identify the right expertise. So we saw that the resources are there, but being able to reach out to what I mentioned, the GP expert and the regional coordinator helps a lot in the design process, and also helps to identify the information that is already there in terms of qualitative reports or quantitative data. And now I would like to move on to present some of the findings of the work. The country profiles, both of them highlighted. Alvina, if we can move to a previous slide. Yeah. Okay, I think. So the country profiles highlighted vast disparities between women and men in access to health services and their vulnerabilities in urban and rural areas. In Senegal, for example, we saw that the impact of droughts and floods increased health problems among women. A 2020 flood assessment revealed that approximately 216 pregnant women between 16 and 39 years old were exposed to the risk of malaria due to the presence of stagnant waters, causing severe health issues. The country profiles also revealed challenges that women face in terms of preparedness. For instance, in both countries, we found that early warnings are transmitted in public places, and women may not be able to receive them as they are usually at home taking care of children or doing chores. More specifically, in Ethiopia, for instance, in the event of a flood emergency, access to early warning information would often come through mobile phones. However, we found that mobile phones were used by men more frequently than by women, and the difference was 46% men and 3% women. So there was a significant difference there. So in our discussions with client countries, we also were able to gain important insights in terms of coping capacity. For instance, when a household is affected by a disaster, the availability of coping mechanisms such as finance that Alina mentioned and also savings play an important role in the recovery process. And here I would like to bring up the Ethiopia case. Overall in Ethiopia, the share of individuals owning a financial account is quite low. Only 18% of women and 30% of men own a financial account. In our research, we saw that a potential reason why women have less access to formal credit is that they are less likely to own and control physical assets, which serve as collateral. And this in turn affects their capacity to cope with future shocks. So these were some of the main findings that we were able to see in both countries. And we've also developed a few recommendations. These are key recommendations that apply to both countries. However, I'd like to mention that each country profile has specific findings and specific recommendations tailored to the research that we did in each of the countries. So the main recommendation, one of the main recommendations here would be to make women's representation in decision-making bodies a priority. So both country profiles point to a lack of representation of women in decision-making bodies at the community level and beyond. And we think that this can be an opportunity for projects to contribute to women's empowerment. However, we also saw that a major barrier and a huge disadvantage in building the case for dedicated activities in terms of promoting women's empowerment is the lack of specific data. So therefore, collecting more data on women's representation would help to better shape these interventions. And moving on to the second recommendation, which focuses on women's access to land tenure rights. Both country profiles, again, found that women tend to face more insecure tenure arrangements and land ownership, and this makes them less resilient to shocks. In case of a flood situation, for instance, land ownership makes it easier to move because people can use land titles as collateral, and this helps them access cheaper finance after a disaster has happened. So improving women's awareness about the benefits of registering a land title may be an important entry point in terms of as an intervention to support women's access to land tenure rights. So these were some of the recommendations. And now moving forward, I'd like to tell you what we are doing. So we are building in on this momentum and have.
Thank you, Ariola. I'm Marcela Natalicchio, and I'm a lead gender specialist for the CRF, the Canadian Caribbean Resilience Facility. And I'll be presenting about the case of Jamaica. We took the example of Ethiopia and Senegal, and we decided to do it for Jamaica, but it was different in terms of for what we produced this report. Can you go to the next slide? Thank you. So in this case, we wanted to provide inputs for the country strategy that is being prepared for Jamaica. We wanted to influence country programming through the systematic country diagnostics and in terms with the country partnership framework, and influence the country dialogue with the client on DRM and gender. And at the same time, fulfill some of the objectives of the Gender Action Plan for LAC that wants to influence more these CPFs. So it wasn't just about operations, but the CPF. It was thought that the likelihood that the DRM and gender will be included in programming and in turn on projects, it's higher if we manage to have these inputs in the country partnership framework. So we produced this analysis as a standalone document for project preparation, but at the same time, it became part of the gender assessment that was produced this fiscal year to be included in the systematic country diagnostics. So we did a collaboration with the gender coordinator for LAC for this purpose, because she was involved in the gender assessment, and she requested that we provide these inputs for the gender assessment. This all is in process, so I don't know exactly what is going to happen at the end, but I can tell you that the insights were included in the gender assessment already. So we can go to the next slide. And why it was important to do it in the case of Jamaica? Well, Jamaica is highly exposed to natural disasters. So we have 96% of the country's income and population at risk for 2 or more hazards. And at the same time, even though Jamaica has made some progress in terms of gender equality, it's a very different picture than what it was presented by Ariola in the case of Africa. There's more gender equality in the case of Jamaica, but there are still some gaps, especially in terms of gender economic inclusion, voice and participation, and gender-based violence. So as Albina said, natural disasters are gender neutral, but their impacts are not. And given that there are inequalities, we were assuming that women and men will experience different the disasters. So we can go to the next slide. We looked at the policies in Jamaica. They do have policies in terms of DRM, obviously, because they are so exposed to natural disasters. They experience many of them during over the years, and they also have policies regarding gender, but they are not well integrated, meaning that the DRM policies make references to the importance of considering gender in the assessments and the whole cycle of DRM, but the implementation is weak, and they are not, we couldn't find outcomes or indicators to monitor the situation. So we decided to do this analysis following the framework that Albina presented. We thought it was great in terms of capturing the different moments of the disasters and the impacts on women and men. So we look at the impacts in terms of exposure and vulnerability, preparedness, and coping capacity. Next slide, please. So I wanted to present some of the highlights of the findings. As I said, Jamaica is very different from Ethiopia and Senegal. We see here that women have better educational outcomes than men. So more women are in secondary school, and they get degrees even in the tertiary level. So it's very different. They have a higher life expectancy, but there are still some gaps, high mortality, maternal mortality, and high adolescent pregnancy, for example. So not everything is good. So what we observe in terms of the disasters is that disasters provoke an increased risk for diseases, illnesses, and injuries. Damage to the water facilities, making it more difficult for women to get water, damage to schools and childcare. All these three things have an disproportionate effect on women because of their role in taking care of kids and the household. So they will take care of the sick people. They will have to put more effort in collecting water, and they will have to take care of the kids if they are not able to go to school or childcare. And this will have effects on their level of stress, but also create more difficulties in accessing the labor market and being ready to recover from disasters. So we can go to the next slide. In terms of labor market and economic opportunities, it's interesting to see that despite the fact that women have higher educational attainment than men, they don't have very good outcomes in terms of the labor market. We found that women that are especially vulnerable are poor women, female head of households, and rural women. And in the case of Jamaica, they don't have higher levels of informality, but they do worse in all the other outcomes in terms of labor participation. They have higher rates of unemployment. They occupy lower productivity and lower paid jobs, and there are gender wage gaps. Jamaica has one of the highest incidence of female heads of households in the world. The 45.6% of the households are headed by women. We found in the case of rural women, they are also very vulnerable to disasters because two sectors that are affected in all the disasters are agriculture and fishery, for example. And even though legally women can access to land, in the case of Jamaica, because of norms, they don't actually access to land in the same proportion that men do. And they also don't have the same access to input technology and knowledge. So during disasters, we will see that specifically these three groups, poor women, female heads of households, and rural women will be impacted disproportionately by disasters. In terms of voice and agency, again, despite the fact that they have high levels of education and they have one of the highest proportion of female managers in the country, they have very low levels of participation in politics and the local and national level. And we see the same in DRM. And they have very high levels of gender-based violence. And we know there's very solid evidence globally that gender-based violence increases during disasters. So that's what we're gonna see in the case of Jamaica. We can go to the next slide. In terms of preparedness, I'm not gonna go into the details, but we found in general that in the Caribbean, and in the case also of Jamaica, the gender dimension is not very well included in these systems, both in the design and in the implementation. And in terms of the coping capacity, as we said, female heads of households have less resources to cope with the disasters, so they will be worse off in terms of recovering. They have less chances of migrating. Younger people tend to do it, but women with children have a difficult time migrating. In terms of financial services, we have a different picture than it was presented for the case of Africa. There's a high level of access to financial services in general, and men and women are very similar, 79% for men and 78% for women. So this is actually promising in terms of cash transfers programs for emergencies, for example, because they do have already this access. And we also found that female heads of households, they have a significant access to existing social protection programs that can be used during emergencies. So we can go to the next slide. So data collection on gender impacts during disasters needs certainly improvement. We used for this exercise, we looked at the assessment of impacts for disasters from 2001 to 2017. And unfortunately, there's very little data specifically on the impacts of the disasters on women. So this absolutely needs to be improved. Then more assessments need to be conducted in terms of vulnerability to provide the information and to prepare for disasters better. We see a need for an increased support to women to reduce the impact of the increased burden of childcare and household chores, because as we said, we see this as one of the factors that prevents them from accessing the labor market, and they also have to bear the burden of, the people that get sick, or the kids that are unable to go to school, or the water collection because of, the damage of the water facilities. We see a need for targeting women in restoration of livelihoods, especially in agriculture and fishery, because rural women are a clear disadvantage in Jamaica. We recommend targeting vulnerable women for cash transfers and subsidies for housing reconstruction, because we see that they are most affected in terms of housing damage. And finally, this is very important, there's the need to prevent and respond to gender-based violence that increases during disasters, and unfortunately we don't see that the countries are doing enough. So we will need to pay attention to shelters, do more audits, training protocols, training of the responders, awareness campaigns, declare some services essential, such as shelter for victims, hotlines, widespread knowledge of referral pathways, etc. We think this is a very important area where the Caribbean countries could do an improvement. Thank you very much.
Should I just go on?
Over to you, Cindy.
Thank you. Good morning. My name is Cindy So. I'm with the Global Gender Group. I'm responsible for the team that does the gender tagging after your project is approved by the board. I think you've heard a lot about, the gender differentiated impacts of disasters on males and females. A lot of recommendations about what to do and things to look out for. So I thought that the gender strategy, which impacts the World Bank Group, it gives a very sort of neat organizing framework for when you think about your project and say, but which aspects of the disaster and males and females being impacted differently do I talk about? There are four major sort of pillars of the strategy. One is human endowment, which has to do with health, nutrition, education. But we believe that in DRM situations, it's the other three that probably sit squarely or are very relevant to disaster impact and project design. Of course, it's the jobs, labor force participation for men and women being different. Three is, of course, that you heard throughout this morning about women's less access to financial and a control of assets and collaterals. The other thing is, women's voice and agency, which very much I think Marcela talked about with the GBV and the safety and security. So if you go to the next slide, what is this gender tag that we're talking about? It started in FY17. It's for IDA and IBRD capital increase commitments, but it also has a way of measuring how we are doing in terms of implementing the gender strategy for the World Bank Group. We've been doing really well as an institution. Since it was instituted in FY17, you can see that we went from to 81%, starting from 50%. You just want to focus on the last set of the columns, and it's organized by financiers. It's a bit confusing, but we ended in FY21 at 81%. In FY17, the baseline was 50%. So you can see that World Bank operations are doing things differently. They are meeting what we call a gender tag criteria. But when it comes to DRM projects, it's a bit interesting. We have data for FY19 through 21, and it's a bit difficult to give you the scientific data because our GPs went through a lot of reorganization. So some projects fell under, who fall under GPearl may have fallen under a different GP. So when we try to get the data in FY19, 30% of the projects, and there are 10 projects only, were tagged. In 20, 8 projects out of 16 were gender tagged. And FY21 last year, 2 projects out of 7 were gender tagged. So what does this all mean? I just want to tell you, if you go to the next slide, what the gender tag is looking for. It kind of has all the components that Marcella, Ariola, and Albina spoke to, but it kind of puts it all together, right? So for a project to meet the gender tag, what we say is the following: just provide a very logical way of talking about what is the issue for this project vis-a-vis men and women, and what's causing it. So some sort of a description about the gender gap and what's the driver behind creating that gender gap. And then once that's identified in your project, what are the specific project interventions that you are proposing to address that driver, right? So it could be about security, it could be about the lack of assets, lack of financial accounts that were talked about several times today. But then, so you are going to have to say something about that. We're going to promote or help women gain financial, inclusion, access to mobile accounts, et cetera, et cetera. And then the most important part of the gender tag, and the most challenging part for many project teams, is to come up with an indicator that actually monitors, is that happening or not, right? The actions that you propose, how is that making a difference? What is a delta? And I think this is the biggest challenge that we have. And we have a lot of GP experts that we have trained in the last 2-3 years who are there to help you. I'll be happy to circulate the resource list of names later. But then I just wanted to give you one very concrete project example where we felt that this project met the gender tag for the following reasons. And this is how we kind of try to organize our understanding when we read your project appraisal document. So we first look for the analysis, right? What is the project saying about the gender gap? And this is a project that we tagged Indonesia DRM project. And they're saying, nothing surprising to you, which is that women are more impacted in disaster situations because they have less timely access to information, and also how to be prepared in case, right, a disaster happens. So for all these reasons, women are impacted more adversely. And then the project then goes on to say, okay, so what are we going to do about this problem? They're going to say, they say, we're going to promote more increased, access and use of mobile phone usage for women, so that they actually get the timely information as well as men would. There are other actions, women facilitators, outreach, advocacy, and making sure that all the infrastructure and facilities that women may need that's different from men are all available. The other, of course, is what Marcella talked about, is outreach, again, working with women's organizations, training and preparedness. But what we found the most concrete, if you will, from this project was the one that's in bold. The mobile phone application, that's measurable, that's very concrete, and we know that it directly addresses the problems that the project already talked about in the earlier part. So then the indicator is, once again, very relevant, right? They're going to monitor and report on the share of registered users of mobile phones for early warning dissemination who happen to be women. So they're measuring the increase from baseline of, let's say, 10% of women as opposed to 40% of women having mobile phone applications, to some sort of a target that says, 60% of women will also have mobile phone applications. And so that the gap between men and women are sort of, reduced this way. So that's ultimately what the gender tag is asking, that you find a problem, if there's a problem relevant to your project, propose specific actions that can be measurable and monitored, and finally give us an indicator that you can measure that shows a reduction. Even if the reduction doesn't happen at the end of the day due to many factors of the project implementation, the indicators should be set up so that you can monitor the trend. So that's the mystique behind the gender tag. I have one more project, but I think the idea is the same. So I think I'll just leave it here. And Peter, maybe go back to some discussions or questions and answers. Thank you.
Okay, thank you, Cindy. And thank you, Alvina, Ariola, and Marcela for the great presentations. So why don't we open it up for any questions or comments that people may have? You can either unmute and just talk. I think we have about 7 minutes left. Or you can post them in the chat and we can read them out. Anyone? So while people are thinking, maybe I can just ask. So I know that you did, so one of the countries that I cover, Ethiopia, there was also the assessment done. And can you just explain to us in terms of what is required from the task teams in this case, and what are the budget implications? Because everyone is going to say it's great to do this, but do I have to pay, and how much do I have to pay? Maybe you can just explain that to us. Anyone, either, I know Arhola and Alvina, you were both involved in those, right? Well, Marcela too. But at least in the Ethiopian, what was how did you finance it? Was it GFDRR? Was it our region? What's the expectation?
Yes, thank you, Peter, for the question. I think, yes, that's important because we also had, when we started our collaboration, there was this confusion about who is going to be in charge of the budget, where are we going to find the people, who is going to work on it, what is the time commitment. So in this case, GFDRR, like we collaborated with GFDRR. So basically in terms of budget was coming from GFDRR. In terms of human resources, as I mentioned, there was a focal point that the DRM team assigned. And for this type of assessment, it was super important that that focal point was locally based. So like in Senegal and Ethiopia, given that they were able to connect with key DRM institutions easier, they had the previous connections, and we were able to find to identify specific data and information easier. Now, as I mentioned, in terms of a specific, and this was more of like a country local assessment, in terms of the specific project, resources are there. We have GP experts, as Cindy mentioned, there are regional coordinators. So these can be like two main resources that can be helpful for teams. We also saw great value in having social development specialists involved because they also know the country context. And also poverty economists who had a lot of recent data, right? So being able to bring these main people with this expertise together, it takes time, but it's not impossible. So again, resources are there, just being able to start early on and having those discussions as early as possible. Even whenever you are have a PCN at the PCN stage, a draft PCN stage, involving the GP expert and the regional coordinator, I think that's very helpful. And this is what we did with the Ethiopia and Senegal. I don't know if Alvina has something to add, or Marcela.
I don't know, Marcela, if your experience in Jamaica and the other countries have been different. Because I know you also have this longer version in Jamaica, and then you're doing these briefer. And I think it would be good to mention that.
Yeah, exactly. For the cases in the Caribbean, we are providing the funds through the CRF, which is a trust fund. And what we have is, depends on the country, but it's very similar. For Jamaica, we have somebody who is looking for data, specifically the quantitative data. And I was able to benefit also from the gender assessment that was very recent for Jamaica. So I had a lot of data in that respect. And then I relied on, as I said, the impact assessments that are made in Jamaica of the disasters. And I combined that with the global literature and literature that exists for Jamaica in DRM and gender. But we didn't have, and I think it would have been helpful too. It's a good methodology from what I'm hearing from Ariola, is to have the links to the country and be able to get more data from the country. I can tell you that it was very difficult to get information about DRM and gender in Jamaica. The impact assessments are very poor in terms of pointing to the specific effects on women and all the different effects between women and men. And that's why we are recommending that they do a little bit more. This is not the case for all the Caribbean countries. I've seen that, for example, in Dominica, these assessments are much better. I don't know if it has to do with the fact that the assessments in Jamaica are done by the country. In the case of Dominica, they had a very bad Hurricane Maria, and many partners got involved in the assessment, including the World Bank, and it was much more specific about some of the effects on women and men. But it was basically, in all of the cases, and the longer paper for Jamaica and the shorter versions for other countries, it was basically a desk review that we did. But even in that desk review that is more limited, we were able to get some interesting data that was very useful for projects. And we are using the shorter versions also to provide inputs for the teams that are doing operations, I have to say, for doing the gender tagging. So.
Okay, thank you. So I think we are out of time. I don't see anyone having a burning question or comment in the chat function. So let me just say, I mean, we're talking here today about the DRM programs, right? Because obviously when we respond to disasters, that's when we very quickly design and think about the impacts on the differentiated populations. However, this is also important for our other programs, the urban programs, and I think more and more, at least in the context of doing more integrated programs within urban DRM or between DRM and water, or DRM and environment, for instance, increasingly with the climate impacts. And so there's a lot of resources out there to help us. And I think, at least as I said earlier, in the Africa context, the RVP has said that they do want to see more and more projects being gender tagged coming. Like we have the co-benefits, right? We have a minimum requirement, at least in Africa, of 30% co-benefits. And no project get approved without them. Now, he's not saying no project without the gender tag, but I think it's important to have to show. And I think, as Cindy was saying, I mean, it's a lot, I don't want to say simple, right? But it's a lot more manageable to actually gender tag than even I initially thought, right? It sounds like something very complicated, but I think we just have to show something where we will have a positive, we identify the gap, we will then do something in our project where that'll have a positive impact on the gender gap that exists, right? And I think what's really exciting about the country profiles that can be done for relatively low cost, there are resources available, I think through GFDR as well, where you could think about other countries. And then, as I said in my opening, at least in the case of Ethiopia, I think it helped us a lot when we could say we had this assessment that was done, and we are drawing on parts of this assessment actually into the design of our DRM project that we were doing now. And then also actually, what happened at the ROC meeting, the RVP was saying other GPs should be looking at the assessment too, to think about how they could be using the gaps identified, because obviously not all the gaps will fall on us, right? As GPO, some could fall on other GPs to address, for instance. So I think with that, I think this is very important topic, and it will become increasingly highlighted in the review meetings as we go forward, especially now where I think the world is facing. I think our RVP was saying in an early meeting we have 3 shocks, right? One was COVID, we're recovering. The other one is climate, which is sort of slow and fast moving at the same time. And then now the third one would be the fallout from the current war in Europe. And that's going to have implications also. So I think we'll be asked as well to look at sort of the distributional effects of those, and not just across income, but also between the gender dimensions as well, right? So with that, let me thank all the presenters for doing an excellent job and for educating me a lot in the session as well. I appreciate it, and we look forward to more of this discussion, and hopefully we can have something, I guess, in the not too distant future in person, right? As things resume seemingly fast back to normal right now. So thank you, everyone, and I hope you have a good day. Thank you.
Thank you, Peter.
Thank you so
everyone.
much.